Good day, everyone. My name is Juliet. And so, this moment I want to just let us know that apart from the usual data collection, I'm building a system across One Health. There are some other issues that we need to know that are like barriers. And when it comes to acceptability, not every community is ready to cooperate. And so there are cultural issues, there are traditional issues, beliefs, myths that people can't just do away with. So even when you get to such communities, you try to tell them, you do this, you do that, and things will work out. They will tell you, no, you can't just come and influence us. We have our ways of doing our things. And some of these problems keep lingering, and they are becoming problems. In most communities, you found out that there are no basic amenities. When it comes to social ones, hospitals, no good hospitals. There are no, they don't have signals, telecommunication signals, electricity. And so what do you do in a situation like that? So that was, I've decided to just let us know that these barriers we also have to consider when we're trying to design a system. Some of the diseases that people have in some villages, this is just a social group, and as you see them with red cap and all that, they are like the chiefs. They are like the good people that are valued in societies, in communities. And except they say something, whatever it is they say is what is going to be taken. And PS, participatory surveillance, has been known in some cities that has been known, going on, and things are moving on well with them. But in rural communities, this is just like a rural community. You can see the aspect, just look at everything about it. What can you see? No light, no electricity, nothing, no signal. How do they report their cases? Except one is able to maybe send somebody that reports from time to time. You talk about conflict that make people to migrate, go to a particular place where they are gathered. Look at this. What can you see from here? They are not even, they are just after their life, what they can eat. Nobody cares whether there's disease or not. And so challenges exist, and in diverse communities, some of the diseases they have, they don't report because they believe if they report, nothing is going to happen. Nobody is going to listen to them. For instance, dengue fever, when such happens, it affects the joints. And they will tell you there's a name they call it. That is because of spiritual beating, and because of that, there is no medicine that can work for that. Things like liver cirrhosis, people have that aside, they won't report. They say because somebody has been wicked or that gods are after the person's life, they will not report that. They will rather go to herbalists and traditional healers. And cases of poliomyelitis. In Nigeria, in the northern part of Nigeria, there was a wild virus circulation in 2007. Not many people allow their children to be vaccinated. Why? Because they believe that will make them sterile. And there are many of them, many like that. Myths and cultural beliefs deter participatory surveillance in most rural communities. And they can't just do without believing what they believe in. So this afternoon, I just want to let us know that these barriers exist. And these are things that we really need to target and also work on to make sure that our work goes on. The issue here is most people who have what it takes to report, especially in cities, they do. When there was an outbreak of Ebola in those days, 2014 in Lagos, it was halted because the doctors, the nurses that came in contact with the man actually reported, and there was a quarantine. They were isolated. And so what do we do? Education is key in such hard-to-reach places, in such communities who are so stuck to their cultural beliefs and myths. We have to keep educating them and trying to let them know the reason why they have to come along with us. Communities have to be empowered. We have to provide the amenities. In such places where there is no electricity, we can decide to probably provide power packs for them and see how that can work for them and other wearables. Thank you very much.